what I want to talk about is food for a healthy and active life, which of course refers to the definition of food security that the world has agreed to since 1996. And PEAR, as everyone knows, has been working on food security since before food security was even a term in the world. And throughout that, I think the efforts that he has made have been on how agriculture and food systems can contribute to health of human beings, and that's what they're supposed to do. And I continue to be amazed in all of the work that I'm involved in today, how relevant his contributions over the past decades are still. I think it's evidenced by people are always now asking him to chair and speak at all of these events on nutrition and agriculture, because the work that he's done was truly ahead of his time, is now very much in vogue and very much in demand. So it was really a privilege to be able to study here with PEAR, and now to be able to come back and talk about some gaps in this area that I see now, that I think we're at a critical time point to be able to shape food systems to better improve nutrition and health going forward. So right now we're at a time where the world is kind of discussing what are our goals. The post-2015 agenda is being discussed. Here's the UN Zero Hunger Challenge. And among these goals in the Zero Hunger Challenge are 100% access to adequate food all year round. Of course, again, referring to food security. So the question here is, we talk about what are we aiming for with this? What is access to adequate food? And what is the agriculture and food sector supposed to do about it? Probably the sector that is primarily implicated in making this goal a reality. I want to start by looking back a little bit at history and going back to the 60s and 70s, where I think we at that time knew what we meant by access to adequate food and knew exactly what agriculture was supposed to do about it. And look at how that's informed where we've gone to today. So at that time, of course, it was the time of the Green Revolution, the formation of the CGR system in 1971. Nutritionists and agriculturalists were really pretty much aligned on the very fundamental importance of calories and food supply, fears of food shortage, fears of famines actually happening, fears of mass starvation. And what agriculture really needed to do was produce more calories. And this document from 1972, which was an exploration of possible World Bank actions on malnutrition problems, the year before nutrition was established as a department in the World Bank in 1973, pretty much sums up the attitude, which was deficiency of vitamins and minerals is well known, caused serious health problems. But the therapy is now well known and relatively easy to apply, so magnitude of this problem is almost negligible in relation to the one created by lack of calories and proteins. And I think that today we wouldn't say this anymore, but functionally in agriculture we still operate as if this is the case. So at that time, in the 60s and 70s, the concept of food security was invented. In the 1974 World Food Summit, it was defined as the availability at all times of adequate world food supplies. The nature of the main nutrition problems were pretty much hunger and protein deficiency, micronutrient deficiencies as well, but the previous quote showed you where they were in the hierarchy. The data we had on malnutrition was estimates from per capita food supplies, mostly. That was the global data. And the main cause was considered to be lack of calories. And the data on apparent causes of malnutrition were dietary energy supply and protein supply. This is actually a pretty coherent picture. We would probably say it's a limited picture, but it is coherent. So today, of course, things have changed. In 1996, the World Food Summit came to a new definition of food security, which we still use: the physical and economic access to sufficient, safe, nutritious food to meet dietary needs for a healthy and active life. That's food security as we understand it now. And nutrition problems have shifted. We have stunting, also increasing obesity, micronutrient deficiencies have thoroughly been recognized. And we have good data in most places collected regularly on malnutrition prevalence and anthropometry mainly. And we understand the main causes of malnutrition to be inadequate food, health, and care, the UNICEF framework. And the data we have, well, let's look at the data that we collect on these causes of food, health, and care. So in the 70s, again, we had dietary energy supply and protein supply. Then, as we understood more of the food, health, and care, regularly collected data sets, and I was looking back at the UNICEF State of the World's Children report, the SCN reports on the world nutrition situation, and the FAO State of Food and Agriculture and State of Food Insecurity, the flagship reports of these organizations that distribute globally collected indicators. So in the 80s and 90s, we really developed the health and care side and regularly collect a number of indicators on that. We continued to collect dietary energy, undernourishment was developed. Supply of iron and vitamin A was collected really just to estimate the prevalence of those deficiencies. Not so much about a food system, but because we didn't have good biochemical data. 1998 was the first year that UNICEF, State of the World's Children, dropped all food indicators entirely. So the dietary energy supply and undernourishment continued to be reported by FAO, but UNICEF went entirely to health and care. Now this year, we still have those nutrition flagship publications reporting health and care. FAO is reporting dietary energy supply, undernourishment, protein supply, percent of calories from starches. So, and also I want to point out, you can see that the health and care indicators have actually evolved since they started. The breastfeeding indicators have changed over time with our understanding of the major important time periods. So why have the global indicators of food, the food domain, not evolved with our understanding of the problem? So one of the first reasons, I think, is nutrition really went away from food for a long time. And our attention has been elsewhere. I think the 70s was really the last time the field of nutrition was very focused on food, and we got disenchanted with food. This, I think, really sums it up. The first State of the World's Children in 1980 says the major lesson of the last 20 years is reductions in malnutrition cannot be achieved by increases in food production. We went towards the really developing the health and care side in our story. You know, this was a time period of a lot of discord within the nutrition community, a lot of wrangling about what are the priorities. And of course, before the Lancet series in 2008, before the Sun framework, before the 1,000 Days Partnership, this time period, I think, was really the time for nutrition science to get our story straight. And as a part of that, we became a little bit isolated and almost like a cocoon of nutrition science. And I think a second reason is there's been a long tradition of, when it comes to food, of personal responsibility. So nutritionists, ever since the beginning of nutrition, have really been focused on counseling people how to select foods. This is the first dietary guidelines in 1917, how to select foods. And ever since the turn of the century, where deficiencies were discovered, the response has been about supplementation, fortification, nutrition, education. And food systems really haven't traditionally been a huge part of nutrition science. And then there's also arguable political and pragmatic reasons. It is politically easier to avoid the whole topic and focus on what nutrition can do on its own. Shlomo Reitlinger in '93 had this quote about why there's a focus on micronutrient programs. And earlier this year, I think this was echoed in Pear's commentary in the Lancet series. But there is a problem of avoiding food, as has already been talked about by many speakers today. Poor diets are becoming more and more obviously the biggest problem in nutrition. We have here, this is a third of the countries that are identified by the first Lancet series of the high stunting burden countries, and all these countries also have overweight and obesity of over 40%. 10 of them actually have rates over 50%. And the we're very familiar with this picture. So Africa and South Asia, also those are the areas with the largest projected increases in diabetes. Certainly this is diet related. That is this data from Institute for Health Metrics and Evaluation out in Seattle lists dietary risks as far and away the top contributor to years of life lost in developing countries. And when you look into those, this is actually not even considering undernutrition at all. These dietary risks are all about chronic disease because we don't have the data to separate out which proportion of undernutrition is due to dietary causes. But that would certainly be an addition of the years of life lost. And then the contributors to that, low fruit, high sodium, low nuts and seeds, low vegetables, low whole grains, low omega-3, low fiber, high processed meat. So it's becoming clear there's definitely a problem with food that's contributing to poor nutrition and health. So what is the cause of that dietary problem? This is listed as a key message of this year's FAO State of Food and Agriculture report. I think that for a long time, most nutritionists and agricultural economists have agreed with us. The action on the nutrition side has been really a lot of nutrition education focus, but I think probably most of the nutritionists in this room wouldn't 100% agree with this statement of the cause of poor diets. There's this focusing only on consumer choice ignores whole fields of study of social science and nutrition, community nutrition, and nutritional anthropology. This is Gretel Pelto and others' model of all of the ecological factors that affect diets, which is much, much more than personal choice. So the concept of the food environment here is, I think, really critical. I think the food environment is constraining and signaling consumers what to purchase. It has to do with what foods are available, what foods are most affordable, relative prices, what foods are most convenient, what consumers have information about, and what foods are marketed, encouraging through advertising or strategic placement. I know Brian Wansink here has done a lot of research on the nudging of how environments influence what people consume. And just taking a general look at the food environment very, very broadly in sub-Saharan Africa, the availability, let's see, of fruits and vegetables is about half here of what is required. And this is per capita, so this is assuming equal distribution, which of course you can't assume, but even given equal distribution, there would be far less fruits and vegetables available than needed. And pulses, same story, whereas with equal distribution, there is actually plenty of starches. And then the relative prices reflect this in Bangladesh. Most of the income for food, most of the food budget is spent on the non-staples, even though they contribute a very, very small proportion of the diet. So what's the solution to this? One solution is home gardens, increasing access at the very, very local level to correct that food environment. The other solution that I think is mainly pursued is income. And again, assuming that with income increases, this will even out. People will choose fruits, vegetables, legumes, healthy diets, and this picture will improve. But I think the problem is that while we're waiting for that to happen, for incomes to increase, diets are already changing towards what is available. So this was in Tanzania, where I did my field work. All of the schools have this sign in the whole area where I was working. Another McDonald's being a kind of symbol of dietary changes that influence the way people eat. Not to single out McDonald's as the cause, but it is a kind of representation of the reach of global food marketing and the increasing availability of fast foods and unhealthy foods marketed worldwide. And this just to say that habits and norms change over time. This was a really fascinating story in the Washington Post, actually dealing with social transfers and how people who received food stamps really had basically no option but to spend them on unhealthy diets because that is what's available. And is the demand really coming from individuals or somewhere else? So Pear wrote again this year that in high-income, rapidly growing low-income countries, the agriculture sector has become or is rapidly becoming a supplier of raw materials for the food processing industry rather than a provider of food for direct consumption. So again, looking at this goal of access to adequate food, and given the advances in our conversations about food security, the nature of nutrition problems, does it really make sense to continue to measure this goal with a 1960s era indicator? That probably did make sense at that time, but no longer. This is one of the recommendations in a global consensus document that I've worked on in the Ag to Nutrition Community of Practice. And there's a growing consensus that food and agriculture policy can have a better impact if they monitor dietary consumption and access to safe, diverse, nutritious foods, which is that's what the vision is. So it could include food prices of diverse foods, dietary consumption indicators for vulnerable groups. So it's a simple idea and concept, then operationalizing it, what are those indicators? I think that's where the question is right now. So for the first time this year, the State of Food Insecurity report from FAO actually lists a suite of 30 indicators for food security, but I think there are very few that actually measure access to healthy diets here. And the one, of course, they still continue to report, we know doesn't correlate well with better nutrition, the prevalence of undernourishment, basically a lack of adequate calories, has a very, very low relationship to child stunting. And also in an analysis we did at the bank of countries that have met one of the MDG1 targets on undernourishment, only 6 out of 21 of those countries have met the underweight goal as well. So there's a low correlation. This one is reported by FAO. It maybe has some potential. A new analysis presented earlier this year at IUNES said that diversity of national food supply is a predictor of child undernutrition outcomes, and that's independent of income, calories, and other variables. And it has a higher just pure correlation as well. So maybe that has potential, but is it sufficient? Even though it's correlated with stunting, it's probably not correlated with chronic disease. Actually, the same analysis found it was not associated with obesity rates. And also, percent of calories from starches, I'm not sure what the policy response is exactly. So here are just some examples of food indicators. I won't go through them all, but the point here is not that we should necessarily use all of these indicators, but that we really need to come together and get our act together basically as a nutrition community on what indicators we should be measuring to reach this goal. So national level, percent non-starches, maybe fruit and vegetable availability. A new analysis out of Emory shows that in most countries in the world, it falls below the need. So people cannot possibly meet the dietary recommendations. Sugar availability has been in the news for association with diabetes prevalence. There are others. Local level food environments needs a lot of work. There's cost of diets, relative prices of different food groups. Community level production diversity has been associated with household dietary diversity. Household level food security, there are some real advances here in dietary diversity scores and an experience scale that's now being piloted globally in Gallup and could possibly be incorporated into MICS or DHS. And the individual level diet quality is just a gaping gap, I think, in information that we do not collect global indicators of diet quality. So we have women's dietary diversity that's well correlated with nutrient adequacy. Cutoffs are being developed. I think there's some big potential there for that to maybe be incorporated into global surveys. Fruit and vegetable dietary variety, I think, Pear, for your question that you asked to Patrick, what can we measure now that would predict chronic disease in 30 years? Fruit and vegetable dietary variety, or maybe botanical variety in the diet, probably is what I would say for that. We need more evidence on it, but there's a lot of evidence emerging how important fruits, vegetables, legumes are at predicting length of life and low morbidity. And then Carlos Monteiro in Brazil has developed a proportion of ultra-processed foods in household food diets. So just going back to the basic need here, it's also just about, it's not always about having the perfect indicator, but it's also about identifying the problem and advocating the problem at levels where people can make decisions about how to change food systems. And right now, we do not have indicators that sensitize food policymakers about how to improve the food system. And there's a lot of energy about addressing nutrition through agriculture, and the main contribution agriculture can make is food. But how are planners supposed to weigh potential options if we don't have any indicators on how the food environment looks or what diets are like? So just to conclude, I think today the global measurement of food access was made for a different world than today. And right now we have data that make it possible at high level to analyze health and care causes of nutrition problems, but not food causes. And I think looking at how the reported data has changed, it is possible that we can make changes in the kinds of food indicators we collect and distribute. So right now is the time, and global institutions like FAO, the major household surveys, need to support this update of food indicators. Thank you very much.